stretching it, like your Thomas test, abscess pain. And the pain he's going to report is not lumbar pain, but that general lower quadrant pain that you're complaining of. Okay? So let's scoot back again. So that's psoas abscess, all right? Obturator, the obturator muscle is infected from the peritoneum or a peritoneal infection or appendicitis. I have him here. I stretch him into internal, external rotation. I'm stretching obturator, and he's complaining of lower quadrant pain. Okay? All right. Appendicitis. He's in extended position. ASIS, umbilicus, halfway in between. I'm palpating the appendix, and it's right at the end of the bottom or the caudal portion of the ascending colon. Okay? I'm pressing, and he complains of pain. Now, appendicitis or ellipsoid abscess or obturator, I'm thinking it's an infection. It's probably accompanied by fever, right? Appendicitis, additionally, is accompanied by loss of appetite, early satiety, nausea, bad breath, changes in bowel and bladder, right? So I press here, pain, okay? Here's the umbilicus. Pressing around here gives pain, and I release quickly. Fingers are like this. I press in, release quickly, rebound tenderness, okay? It's a quick decompression of the stretch receptors, and it's pain, okay? So that's periumbilical tenderness. And McBurney's point, appendicitis. Okay, Murphy's compression, so flip over. Women more than men, I'm thinking of renal problems, so upper urinary tract infection. I'm seeing signs and symptoms consistent with some renal pathology, like change in urinary frequency, increased frequency, burning, changes in color. So below the costal, my last few ribs, I'm at the costovertebral junction, my hand's there, and I'm giving it a shot. So vibrating, okay? So I'm seeing those signs and symptoms with a kidney infection. Addition is fever, too, besides the other things I said. Pseudorenal, he has a history of some trauma, fell on it, it's costochondral pain more in that area. So some history of trauma, a fall, a strain. So when I hit there, yeah, that hurts. But he has nothing else accompanying that, the signs and symptoms that I would think consistent with renal pathology, like the fever, the change in urinary frequency, things like that, okay? So that's your Murphy's. Your hands over there, you hit one side, hands on this side, you're hitting that side. So you're trying to shake the kidneys. You don't want a direct shot. You're hitting your hand so the force is dissipated. Okay? So those are your 4 systemic tests that we talked about. Everyone okay with it? So during that, if you see anything that you think is pathology in that area, try those tests too. Okay.